Good afternoon, everyone, and thank you for coming to hear about understanding society. I'm going to kind of whiz through quite a lot of things about how understanding society can be used for research on biomedical research. I've got lots of web pages and things as I go on my slides, so if you don't manage to pick them up now, as Emma said, they will be made available later. So understanding society is, so I'll just get rid of this thing about understanding society is a multi-purpose household panel survey which began in 2009, and it has a small kind of replica study, if you like, called the Innovation Panel, where we do lots of experimenting, and I'll say more about that later. It builds on a very long-standing study called the British Household Panel Study, which began in 1991. So there's a kind of long history here. At the first wave of understanding society, our target was to get 40,000 households, which is about 100,000 people. And again, I'll say a bit more in a minute about the kind of different samples that make up the understanding society study. Understanding society has a sequential mixed mode fieldwork design. Again, based on research with our innovation panel, we decided to go down this route. So people are invited, from the 7th wave of the study, people are invited to take part either web or face-to-face, and if they don't accept that after a few weeks, then they're offered the other, and then if they don't do either of those, we try to contact them by telephone. And this is a kind of good way of capturing lots of people who want to do things in different ways, but it also fortuitously meant that during the pandemic we had no disruption in our fieldwork. We kept going because we just dropped face-to-face and continued with web or telephone. Understanding Society is a publicly available data set. I'll say more about how you access it later, but there's a lot of people download it, mainly academics, and it's used internationally. And if you're interested in comparative research, it's part of a family of international household surveys that are conducted in a range of different countries. And there's a harmonisation project called CNEF, which is on the screen, and hence you could look at further if you're interested in comparative research. So understanding society is a panel study, which is a bit different to a lot of the studies in CLOSER, which are cohort studies. So understanding society is based on a probability of sample of postcodes, which enables us to kind of provide representative data of the UK households. It follows people of all ages. So because we interview people each year, we interview parents before children are born, then we kind of ask questions about the children from age 0. When people are 10, we start asking them questions themselves, and we have members of our panel who are over 100. It has a large sample size, as I mentioned, so that enables subgroup analyses. So, for example, we have 500 births a year. We have kind of 10,000 people per birth decade cohort. So there's kind of lots of different ways you can cut the study up to do different analyses. We are in the field all the time. So every person is interviewed annually, but each wave takes 2 years, so they overlap. But what that means is people do research with Understanding Society, for example, that looks at the weather, because they can track daily weather and map it to the answers that people give. Again, I'll say a little bit more about this in a second, but we cover multiple domains. So I kind of think the strength of Understanding Society is being able to do research that links different aspects of people's lives. I think, as with many multi-purpose surveys, anyone with a real specialist focus to their research will get frustrated that we have only a few questions on that topic. So the value is in being able to combine it with other subjects. The whole household is interviewed, so you can kind of look at how couples relate to each other in their answers, or parents and children. And then over time, as people have grown up and moved out, it means we have multiple generations, both within and across households. So you can look at that intergenerational aspect of family life. There's a natural refreshment to the study. So as households change, people are born, people will move in together. Those new people, new household members, become members of the study. As kids leave home, we follow them, as well as staying with the kind of original household they started in. So there's a kind of natural dynamic to the study, in the same way as there's a dynamic to people's household lives. We ask consent for data linkage. We have a lot of different geographic identifiers, and most of our data is at the UK Data Service. Again, I'll say more about this, and we provide a lot of support to users around both how to use the data and how to promote policy impact from it. So I think there are 6 aspects of understanding society that are useful for biomedical research. There's the main panel survey, which when we deposit the next wave in November, will mean there are 29 waves of BHPS and 12 waves of understanding society. Secondly, at waves 2 to 3, and now funded for wave 16, we did a biomarker data collection, and I'll say more about that in a minute. We did a COVID survey kind of monthly through 2020 and 2021. We have data linkage linked to NHS data. We have an innovation panel where we do experiments, where we have done quite a lot of experiments about how to collect biomarker data. And we have genetics and epigenetics data available. So I'm going to just briefly run through, very briefly, looking at the time, these 6 different data streams that might be useful for the research you do. So the main survey has a number of different samples. It has a general population survey sample, which is representative of UK households, but then we boosted ethnic minorities. So at wave 1, we boosted the 5 main ethnic groups in the UK, and then at wave 6, we did a second boost for the immigrant and ethnic minority, where we reboosted those groups and added new immigrants who had moved to the UK since 2009. And as I mentioned earlier, we've incorporated the British Household Panel Study. So as an annual survey, we have year-on-year response rates around 90–95% for the general population sample and the ethnic and the BHPS, and about 75–85% for the 2 immigrant and ethnic minority boost samples. During the pandemic, we lost 1 or 2% to those numbers as we weren't able to do face-to-face interviewing, but we're now returning to face-to-face. So we hope to be able to kind of push that back up. And we're currently in the field with a new boost sample of the general population to kind of add to our numbers again. These data are at the data archive, and that's the study number, and there's a big set of information about it on our website. So I've got a slide in a second on the health data that we have, but this is just to give you a sense of some of the other kinds of data that Annual Understanding Society collects. So every year we ask people the same questions about kind of changes in their household or their employment or their partnership or where they live or their job, how that's changed from the previous year, about their income, transport, consumption, all sorts of things. Then we have a set of rotating modules where we kind of seek and consult with our user communities about what's important, and these rotate on a couple of wave cycle. So we've just refreshed our environmental behaviour questions that will go into the field next year. We have a whole set of questions about political engagement. We just released a special data set on that. So there's a whole set of topics that you could link to health for biomedical research. We ask a set of initial conditions when people first join the survey, whether that's at wave 1 or because they've moved into an Understanding Society household, around their childhood and their migration and their histories around employment and partnership and facility. All those things I just mentioned are in the adult questionnaire, but we also have a youth questionnaire where we start asking people questions at age 10 about their family life, their behaviours, things that happen at school, friendships, about their political attitudes and their aspirations and expectations for the future. In terms of health, we kind of have a range of domains of health questions, some of which are part of our core questionnaire. So kind of global measures of health, doctor diagnosis of specific conditions, various scales like the SF12 or GHQ, activities of daily living that are asked regularly. And then on a rotating basis, we have things like measures of well-being, use of healthcare, very detailed questions about use of social care and who gives people support for social care, and a range of questions about health behaviours and measures of sleep, Pittsburgh Sleep Questionnaire. We did quite a big cognition questionnaire at wave 3, and again, we're repeating that again at wave 16. For 15 to 21-year-olds, as well as getting these questions, they also get kind of extra questions about smoking and drinking and illegal drug use, which map onto the questions where they were asked when they were 10 to 15 around those sorts of health behaviours. For 10 to 15-year-olds, we asked them general questions about their health. We asked the SDQ, and we asked things, measures of self-esteem and life satisfaction. Under 10, we identify what we call the responsible adult, generally the mother, who asks answers a range of questions about their children at specific ages, around development stages, SDQ. Then when a woman tells us she's pregnant, we ask about how the baby was conceived and about delivery, any complications. We ask about the mother's behaviour during pregnancy, for example, smoking and drinking, and then we ask a set of questions around kind of early life, like birth weight, gestation, breastfeeding, and things like that. So that was the whistle-stop tour of the main survey. Moving on to the biomarker data collection. So at waves 2 and 3, the main interview was followed up by a nurse visit, and about 20,000 people had this interview. They were asked a range of questions about their health on that day, and then the nurse took physical measures, pretty standard things: height, weight, waist, body fat, blood pressure, lung function, and grip strength. They took a blood sample at the time, which was frozen because they didn't have funds to do anything with it, but we've since analysed it for 21 analytes, where we have about 13,500 people with these data. Things like cholesterol, HbA1c, different measures of inflammation and anemia, liver and kidney function, and some hormones. This week, this month rather, this week, the data is going to the data archive, so it will be available to you in about a month's time. We've added a proteomics panel of 184 proteins based on an O-link cardiometabolic and neurology panel, and that's on about 6,000 people. We're also adding to the data some epigenetic clocks that users have produced and some polygenetic risk scores. So I'll say a little bit more about that in a second. But basically, we're adding all that to the data set. And then we also have another set of analytes we're hoping to add by the end of the year, including things like ApoE. So the third data stream I wanted to mention was our COVID survey. So we started this in April 2020, when everybody who'd taken part in the previous main wave was invited to a web survey. We consulted on questions, and we ended up with a core set of questions around people's experience of COVID, whether they'd been ill, whether they'd kind of been contacted by track and trace, vaccines, all those sorts of things, as well as their employment, whether they were furloughed and working at home, their finances during this period, their experience of homeschooling children, and their mental health. And then there was a whole set of rotating modules kind of related to what we carry in the main survey: caring, social networks, contact with family, all sorts of things, so that you could look at how people's lives, or how people experience their lives during the pandemic compared to their lives before and now afterwards. So we did web surveys every month in 2020 pretty much, and then quarterly in 2021. We did a telephone survey a couple of times with people who weren't regular web users. And in March 2021, along with a whole range of other longitudinal studies, we added an antigen test and consent to linkage to the NHS. So these data are also available at the data archive. So in terms of data linkage, we have, like many other longitudinal studies, been asking for consent to link to a range of admin data sets. And we're currently at wave 12. We've been talking to some of these data owners since wave 1 to try and get linkage. It's the thorn in all our sides. But anyway, we have linkage for NPD, and vehicle details, DVLA linkage, is already available. And by the end of this year, we should have linked credit histories and pension information, and we think Welsh and Scottish health data. And next year, we're reasonably confident, but you can never kind of be totally confident until it's there, that we will have need data, which is the energy efficiency of households, Twitter data, and linkage to people's businesses, the businesses they work for as employees. And there's more information about that on our website. Again, like many of the other longitudinal surveys, during our COVID survey, we requested consent from our participants to link to their health data. And those data are linked now for COVID-19 research only on the UK Longitudinal Linkage Collaboration Trusted Research Environment. So you can get linked understanding society and NHS data if you have a research question that's relevant to COVID. As I understand it, they are trying to broaden that remit at the moment, so that will hopefully, that proviso that you can only do it for COVID research will be gone soon, so you can do it for any research questions that interest you where you would want linked data. So I mentioned that we have an innovation panel. This is our 5th data stream that might be useful to you. So the innovation panel is a small version of Understanding Society where we carry out methodological testing and experiments. It's run each year. It carries our core questions and then methodological testing that we need to do for our main survey. But we also have an open competition that's launched every February for users or for people to put forward experiments that they would like carried out. So there have been quite a few different experiments in the past about the wording of different health questions and how people respond to that. And as I mentioned earlier, we had a full wave, which the next slide's about, where we got people to collect biological samples for themselves. Other things that might be interested is in IP13, which is available now. We ask people to download and use a wellbeing app. IP15 is currently in the field, and we're doing some more self-measurement where we're getting people to measure their waist and hips themselves by sending them a tape measure. And they're also using a body shape app. So they take a selfie of themselves, which is just an outline, and then from that an algorithm calculates their waist and hip and other measurements. They're then interviewed so that we can check how well this body shape app manages to do that. And then at IP16, we're planning to ask people to input data from the Red Book on child development, and both kind of do it in a way where they photograph it or download data, or they just type in a few numbers to see which they're more willing to do. So at IP12, and these data are in the data archive, so you could do experiments with this. You could look at these experiments and reanalyze them yourselves if you're interested. We randomly allocated people to 3 arms, one where they were interviewed by a nurse, one where they were interviewed by an interviewer, and one where they only took part online. And we were interested in a range of comparisons where we did that. So the first was, were people more likely to take part if they were approached by a nurse than an interviewer or just asked to do it on the web? And the answer was no. The response rates were 78 to 80% across those 3 groups with no real difference. But it took the nurse more attempts to get someone to take part in an interview than it did the interviewer. In terms of blood samples, the nurse asked people to give them venous blood or dry blood spots. With the interviewer, they left a kit so the participant could collect a dry blood spot themselves. With the web survey, they were asked during the web survey if they would like a kit, and if they said yes, we sent it to them and asked them to collect it. So possibly not surprisingly, we got a lot more blood when the nurse asked for it and collected it than when we asked people to do it themselves. But in terms of the comparison between venous blood and dry blood spot, we were able to kind of create equivalent risk scores. So we kind of felt that that worked quite well, although the nurse was much more successful at getting the blood. We randomly offered people feedback from their blood or not of cholesterol and HbA1c, and perhaps unsurprisingly, that if you were offered feedback, you were much more likely to take part online than if you weren't offered feedback. And this was most strongly evident in the web survey, and there was no effect of feedback in the nurse interview, which suggests that the nurse encouraging people to take part, kind of feedback doesn't make much difference, but if you're just sat in front of a computer screen, being offered feedback encourages you to do it. We asked people for hair samples, but got a very low response to that. We asked people to go and get their blood pressure measured themselves at their chemist or their GP, and we kind of got about 40% willing to do that, and those results were pretty equivalent to when the nurse or interviewer measured them. We got people to tell us their height and weight, and then we measured them, and possibly, as we all know, that wasn't very accurate. So then the last data stream that we have is genetics and epigenetics data. We have a whole genome scan based on the human core and exome chip, which gives us about 5,000 SNPs, and then we've imputed that. I think actually we now have more than 8 million, but we also have imputed data sets. It's a bit more than that. And then we have also done genome-wide methylation, only for about 3,600 people, where we concentrated on those who've been in the BHPS, so they had a long kind of social and economic history beforehand, and a random sample of understanding society. So that's a quick whiz through our different data streams. As I've been saying all the way through, nearly all of our data you can get from the UK Data Archive, where there are 3 different licenses that you can download the data under. So the most of our data is available for the end user license, where you just register what you want to do with the data, and then you can just download it automatically. There are some things we do. We don't include verbatim data there. We only provide government regional offices. We kind of have aggregated versions of medication and income and things. There's a special license version where you have to apply for the data with an application, but then you can download it once that's approved. And that has a range of geographies, things like LSOA. It has things like school codes if you're interested in looking at education, and more detailed classifications for things like occupation and medication. And then we have data in the Data Archives TRE, where you have to be an approved researcher. There's an application. You can't take the data out. It's in the safe haven, and they review your outputs. And there we have latitude and longitude in terms of geography, full dates of birth, and that's where all our linked administrative data are. For the genetics and epigenetics data, you can access just genetics and epigenetics data alone at the EGA by an application form to them directly. But if you want it in combination with the survey data, there's an application system on our website you can apply to get those data, but you can only combine it with the end user license data, not the more detailed data. And then the linked NHS data, which I mentioned earlier, is available at the UK LLC Trusted Research Environment, and there's a kind of link there for how you apply to it. So Understanding Society puts quite a lot of effort in trying to support users to use the study. And we have on our website what we call a pathway to using the study. So there's on the website, obviously, you can kind of click through these things. There's the study overview, user guides for each of the data streams. You can search for variables. So you would put in poverty and it would bring up all the variables in the study that had poverty in them. All our questionnaires and other feedback material there, as well as a plan for how we kind of rotate our content over the time. We have various videos of how to use the data, as well as kind of in-person training courses and Moodle training courses. There's a FAQ, and then a couple of different kinds of user forum, including being able to make appointments to talk to the user support team directly. So we were asked to give examples. I've got like a second, I think, haven't I, Emla, of the things that people have done with the study. And so I just took a quick screenshot of our publication page, because this is kind of where you would go if you want to see what people have done with the study. And the first three most recent publications are all really relevant in terms of biomedical research, I think. One on allostatic load and work, one on lockdown and physical activity, and the other on furlough and pandemic and health behaviours. So you can see there's a lot of different ways that people might combine the rich social and economic data in understanding society with more biomedical topics. So I'll skip them and just say, so if you want more information about understanding society, we do have a website with a huge amount of information on it. The data are at the Data Archive, and there are these various ways that you can kind of get more information on a regular basis. Thank you.